Hello, welcome to Centricity Electronic Health Record, Documents and Orders 101. In part 1 of the training, we reviewed EHR documents. In part 2, we're going to cover EHR orders. From here, we're going to review reminding our order preferences. The first day of clinic, we have to set a few preferences, and then from there it is remembered. So we'll review the order preferences, reviewing problem lists and diagnosis codes, creating an order within the document, signing orders by the end of the clinical shift, order status of admin hold, and amended orders, and when to correct your orders. For setting your order preferences, you can click the Organize button. There is a job aid available on your RDS Cluster SharePoint Training and Resources site called Setting Order Preferences Job Aid. And really what it walks you through is clicking on the patient's chart, clicking Orders, clicking Organize, and selecting the complete and canceled orders. So if you do not see orders in your patient's chart, please note that is not accurate until you have confirmed your order preferences. Next is to review and update your problem lists, which is your diagnosis codes. Every order must have at least one diagnosis code associated with it. So for providers who diagnose, please update the problems with accurate and active ICD-10 codes to submit accurate orders. This avoids having to submit an amended order. And if you do notice, there is a diagnosis code here called Patient is Self-Pay. In order for Centricity to submit an order, we have to select a diagnosis code, and we have an internal use of Patient is Self-Pay for cash paying patients. Creating an order. This is part 1. All services provided that are circled on the paper fee ticket need to be entered in the Orders section of Centricity. It is kind of confusing for the first time to understand this, but once you get the hang of it, it is pretty easy. So when you're within the document, think of it almost like you have a piece of paper and you put a Post-it note on it. On that Post-it note is your order, but it is also attached to the document because the document is attached to the appointment. And the appointment is attached to the schedule, and the schedule is attached to the location of care, and all of that stuff is synced together in order for the order to be submitted properly. So typically you can open the order within the document and you'll see the order module, or you can also click the Go to Orders button within your form, which opens the same orders menu. And from here, you may sign your orders within the note and still place the document on hold. So please note though that if somebody put an order on your document and you sign the document without confirming the orders, you will also be signing the orders. So think of them almost like you need to look at that piece of paper, but you will also need to confirm the Post-it note. You can't just do one or the other. You have to do both separately. So part of the confusing part is that there is a order button on the left-hand side of your screen that shows your patient's orders, and within there is an add button, and you technically are taken to the order module within the patient's chart and you're able to submit an order. However, when you don't do this with the document, you're creating a new document called Chart Maintenance. Anytime you change anything to the clinical lists, which are problems, orders, medications, allergies, anything to that patient's chart, it has to document it. So that Chart Maintenance document is started once you click on it, and it has to be signed in order for those updates to be completed. So even if you submitted an order within here and you didn't sign your chart maintenance, the order wouldn't be completed. So this is kind of a confusing route of taking, and it's just recommended not to use this button if you don't need to. For part 3 of creating an order, this is the order module or order menu. You will see on the upper left-hand corner we have a date, a description of the order, a status, and a diagnosis code. When you are for acupuncture, your acupuncture codes will preload, and for this example I use student acupuncture, so that is selected. So it is the order up here that is going to be submitted, and it is unsigned, so as a student they will not be able to sign these orders, but they can preload them for the providers. Then you select the appropriate diagnosis codes for students or self-pay patients who aren't billing insurance. Really you just need patient is self-pay. But for those who diagnose properly and submit to insurance, or there is an appropriate diagnosis code coming from a referral, that is when you will use these diagnosis codes to sync to your order. You will select the diagnosis here and click this sync button to apply it to the order. And as a provider you can click sign, or as an intern you can click OK. Now we'll begin our tour. Okay, we are in the training environment of Centricity, and we have some preloaded dummy patients in our schedule. We have Mickey Mouse and Minnie Mouse in for chiropractic visits, Tinkerbell in for massage, Donald Duck for an established acupuncture, and Tinkerbell followed by a student acupuncture. So there are many different types of appointments that will be on your schedule. Therefore, there will be many different types of orders on your schedule. So for Mickey Mouse, I'm going to right-click and open Patients Chart. And from here, there should be a document on hold. And this was started in our document training. I'm going to edit this document and show you the differences in orders. For procedures management within Chiro, the CPT codes are listed in their form. Chiros have a form on its own for the many different types of services that chiropractors can provide, and from here you can see an office call, new level 3 intermittent 99203 is been selected. You can track the number of visits. Up at the top you have spinal adjustments, extra spinal areas, modalities, and active care all listed here. So for this daily visit note, office call level 3 intermittent is all I'm going to apply to this order. If you click the Go to Orders button, it will open the Orders menu. From here, because I'm logged in as myself, it defaults to massage. If you click Chiro office visits, this is where you will find the CPT codes listed as well. You'll note the patient is self-pay is a diagnosis listed up here in the right-hand corner of the order module. If you select this two-lined button, it says Add Diagnosis to Orders, it will bring it into the CPT order. Another way is to click on it and drag it and drop it in. I believe there are some who add a number of diagnosis codes, so you click the control button and drag them all in at once. It will bring up your details of that order by the description, the CPT code, who's authorizing it. You can look at the list of diagnosis codes by clicking the Diagnosis button, and you can also add modifiers here for active care patients. For interns, they will not have the option to sign, so they would just click OK. And for providers, they would click Sign. So even if your document has not been finished, you can still open the document and go to Orders by this Go to Orders button or the Order module here and click Sign. And from here it gives you another preview because I'm in the training environment, obviously this isn't real. But if you reopen that after clicking sign, you will see that it has a status of complete. Now I'm going to end and hold this document, and you will see on the patient's chart, sorry for my screen, it is still on hold and the document can still be edited, but you can submit the order here. But because I haven't synced an actual schedule, this is the training environment, it won't show up here as an order that is complete. So if we go back to our chart desktop and click on Tinkerbell, open patient's chart, and open one of the massage documents here, you can go to the text version, confirm this intern signature, open the order. For student massage, they would select student. For therapeutic massage, they'd select therapeutic. Each one is a different CPT code. And then you can also sync the patient is self-pay, button, drop, whichever way you prefer. If you ever see a pop-up that talks about the uncoded diagnosis code, that means the code is not an active ICD-10 code. If you know for sure that this is an exact diagnosis code and it's not loaded in production of CPS, billing department will tell a centricity administrator to load the code. If the code is incorrect, as in you missed an AD or S, or in this case, it should be a capital patient is self-pay, so this is actually not a real diagnosis code, then billing department will prompt you, and we'll get through that in a little bit. But I'm just going to say yes for this situation. Then I will click sign as a provider and click OK. And for the last example of acupuncture, we'll go into Donald Duck, open patient's chart, and we see acupuncture office visit. That is the one that I want to edit. And from here we can review the document that the intern or provider completed and confirm an intern signature. The quality of the note, obviously you brought it back to them. That's covered in our documents training. So we'll open the order, and from here acupuncture codes are listed a little bit differently in production, but there is a student acupuncture CPT code selected here. Otherwise, a new herbal consult or the acupuncture services that a billing provider will select. From here I selected more than one. So in this instance I do not have any diagnosis codes listed. So the diagnosis codes is actually problem list, and because I'm in massage therapy default, it will show my massage therapy list as default. The smart list is where you want to look for your diagnosis codes. So for headache example, we'll see the active diagnosis codes here. You can click save and continue, or you can just click OK. I'm going to add another one as an example. I'm just using two very common examples. You'll see an active ICD-9 and an ICD-10, and now I'm going to click OK. This does get added to the problems list, and I'll show you what that means in a second. So in this case, let's say we are billing insurance. Obviously, student acupuncture would not apply. So if we go back to the custom list, I'm going to uncheck student acupuncture. And now I'm going to use both of these. So I'm going to hit the control button and select both of them. And now I lifted my hand off the control, and when I pick this up and move it, it's actually going to move both of them. The prompt is telling me that hypertension is not active in the database. Our testing environment doesn't have active ICD-10 codes. So this is not relevant, but if you see this message in production, this is when you want to make sure your diagnosis code is accurate or billing can locate a Centricity administrator to load the ICD-10 code. Click OK, and from here everything is synced, and for students you would click OK, and for providers you would click Sign. So now that we reviewed the 3 different types of disciplines and the order examples for each, now we're going to go through order status of admin hold. A flag or email will be sent to billable providers for any actions that need to be completed with orders. If there is an order that is submitted with the wrong location of care, such as ClinServe, it will automatically be put on admin hold. Admin hold is not a location of care that we provide any service at, so therefore the system doesn't recognize it, and an administrator has to go in and change it. From here, billing department cannot process this order, so you will be notified if any corrections need to be taken for admin hold. Next, we're going to review amended orders. If it's the first time that you're amending an order, you can see the Amending Orders job aid on the SharePoint Training and Resources link. From here, it highlights the differences with amended orders. It first asks for you to click on New Document in the patient's chart that you are amending. When you select the encounter of amended orders, please know that it's important to predate to the appointment that is being amended. Follow the steps outlined in the form, and we'll review in Centricity here. You'll see that I'm in Tinkerbell's chart. Let's say the front desk had notified me to create an amended order, or not the front desk, I'm sorry, the billing department had notified me to create an amended order for Tinkerbell's service 5 days ago. From today, that would be May 15th. So I'm going to click New Document and select Amended Orders. From here, this is where it is very important. I will click, well, May 15th is a Sunday, but in the example, I'll use it anyway. Because Tinkerbell did not see this provider 5 days ago in real life, the appointment isn't showing up here. But typically, you're looking for that associating of the clinical service that was provided that day. Then you can click OK. The Amended Orders form shows you the steps needed. Step 1. What is the correction type that you're making? Is it missing information, incorrect information, or other? Select which one applies. For this, I will state wrong CPT code. If you want to get any more detailed and let the billing department know what the error was, forgot or misplaced or incomplete, that's where you can document in the text box here. A description of CPT codes, modifiers, or diagnosis that you want to add, and a description of CPT codes, modifiers, or diagnosis that you want to remove. The reason why these text boxes are here is because sometimes it can get confusing for the billing department to understand exactly what it is you're trying to amend. Step 3. Submitting the order correction. Click the Orders button on the right and complete the order. Make sure the date of service is the date of that patient visit. It reminds you again one more time here, and it will not be processed if it's not correct. Then you need to sign the order, end the amended order, and route it to the appropriate billing department that covers that clinic. So for here, I will click Go to Orders for Acu, and I will select acupuncture codes, select Established Herbal Consult, and associate the appropriate diagnosis. And from here, we can click Sign. As you sign this document, it will submit the order. I know my screen is expanded here, so it's a little confusing, but from here, you can add more information about missing order, correct date of service. Whoops. it's where you can get more detailed. But the last step in here is if you are trying to let the billing department know, you can type in the last name of the billing department who sent you the alert or flag or email and open that and state completed. From here you can say, just review this and process my order for me, or thanks, and click OK, and click sign to actually route it to that person. So you can see why amended orders is a little bit overwhelming the first time you do it. But once you get the hang of it, amended orders can be quite simple. Next is just outlining the examples of when you need to amend the order. You need to correct the location of care, you need to complete a missing order for that date, correct services that were provided, or correct diagnosis codes submitted with the original order. Again, you may be notified by the billing department to complete amended order or verify an order was submitted versus the fee slip that was used at checkout. Just please be mindful that their way of communicating is through alerts and flags and/or your work email. A little bit more overview here with documents and orders. We're just going to review our due date guide, a little bit on our centricity and quality audits, and the high-level process overview of a patient coming in. The EHR due date guide is just trying to show the examples of the 3 business day policy. So for here you'll see visitor A on week 1. That document is due the 3rd business day. Example, Thursday. It would be out of compliance if you signed it on Friday. For the next example, this is where it gets confusing. For Tuesday, it's due on Friday, but you technically have Saturday and Sunday to finish it, and Monday it would be out of compliance. So for patients who come in on Wednesday, it is due on Monday, out of compliance the next day. This is why the guide was made, so in case you ever get confused of when your document is due, this is a resourceful tip. So when a visitor arrives on a clinical date of service, the provider is to sign the document by the end of the 3rd business day, but the order for that service is to be submitted to the billing department and signed by the end of the same date of service. This is part of the paperwork timeline policy, and I just wanted to review it with you. Next is the audits. So centricity audits will be conducted to help ensure that the critical pieces of information have been completed. As we've noted before, the centricity audits are capturing the location of care, the provider is the correct one, the clinical date is the actual date the patient submitted, signature status, and also it goes over the orders. So the order has the correct location of care, the provider, and is associated with diagnosis codes and the status of the orders. So basically we're just trying to make sure the process of documents and orders is working smoothly. From the next level, it's talking about the quality of audits. This is where the document is actually being audited itself, and this is per the Quality Assurance Committee, and they're looking for certain pieces of the document that are meeting different things. So a centricity auditor is not auditing the quality of your document. We're just looking at the basics of documents and orders, whether they're signed and everything is correct as it is supposed to be. Providers will be contacted individually by email or if any corrections need to be made, and see your supervisor if you have any questions about the audits, whether they're centricity audits or the quality audits done for your department. And lastly, just to step back, take a minute to breathe, the high-level process. This is about our patients, and really electronic health record allows us to store so much information, and the patient will be coming into the front desk. There will be forms and papers and fee slips, and they basically are looking at all of those documents, and we're trying to get it into the computer, but we're also trying to treat our patients. So it is mindful to understand that all of this information should be captured accurately in the EHR. Then the patient leaves and checks out and makes sure they scan any of their documents. We have a couple of things listed here. GE document management is something our front desk uses. They're working on scheduling and collecting payment, and then billing actually submits all of your orders on the back end of Centricity. But the big picture is that all of those appointments are syncing to the proper location that you're seeing those patients for that visit. The high-level process is something just to kind of step back and look at. We're all in this together. It's a lot of people doing a lot of different things, and we're all supposed to be very grateful for each other in this whole process to help treat our patients. So thank you for your time, and this concludes our EHR Documents and Orders 101.